is her pre-medication. We're going to give it IV in the catheter. There are no bubbles in the syringe. And she's hooked up to fluid, so that's going to take care of flushing the catheter. We're going to go ahead and pre-oxygenate her. Okay. We're going to pass the tube over the top of the epiglottis, down into the trachea. You look at the top, right?
I don't care.
Tie it in place. Go ahead and hook up the tube. Our cuff is inflated. I'm going to check that by closing the pop-off valve, inflating it to 20. And I don't hear anything, so open the pop-off valve and turn on the vaporizer to 5. Ketamine is often used in conjunction with Valium as an induction drug. Equal volumes are used of both. You want to use 5 mg per milliliter Valium and 100 mg per milliliter of ketamine. It's important to use a pre-med of either an opioid or a tranquilizer with this drug. The onset is in 30 to 90 seconds and it will last for 5 to 10 minutes. It's very good for short, quick procedures, maybe a cat neuter or something like that. There is minimal cardiovascular depression with this drug. It also will provide good muscle relaxation because of the combination of drugs, good analgesia. There will be an increase in the respiratory depression though. Ketamine is a dissociative. It is a controlled drug that will peak in 1 to 2 minutes when given IV and about 10 minutes when given IM. It lasts 20 to 30 minutes. The interesting thing about this drug is it leaves the reflexes intact. It increases the muscle tone and the eyes will remain open. The pupils will be dilated and the eyeball will remain central in the orbit even when they're under anesthesia. Because of this, it's important to protect the eyes when using this drug as an anesthetic. The heart rate will increase, especially with sympathetic nervous system stimulation. Their salivation will increase, and it only provides a very light analgesia. Because my clinic does not use IV induction drugs, Dr. Wright has asked me to include a short section talking about different IV induction drugs and their uses. One of the classes of IV induction drugs is benzodiazepines. In this class is diazepam, which is Valium, and midazolam. Diazepam is often used with ketamine to be used as an induction drug. Its onset is less than 15 minutes and it will last for 1 to 4 hours. It has very few cardiovascular or respiratory system effects. It does not provide any analgesia. It can be used as an anticonvulsant. It's also a great muscle relaxation drug. It will be calming to old or ill patients but have exactly the opposite effect on young and healthy patients. It will cause them to become more excitable. Diazepam has to be injected fairly slowly and it can only be injected IV. Both of these drugs are controlled drugs. They should not be stored in plastic bags or syringes, and you have to be very cautious in mixing them with other drugs as well. The second class of drugs I'm going to discuss is the alpha-2 adrenergics. These will include xylazine, which is Rompin, and dexmedetomidine, which is dexdomitor. These drugs are not controlled, and given IV, they have a 5 to 15 minute onset given IM, they will have a 15 to 30 minute onset. They'll last 1 to 2 hours. These drugs will provide good analgesia and profound sedation. They will depress the cardiovascular and the respiratory systems. They can cause vomiting and ataxia, and when these drugs are used, you have to be careful not to startle the animal or else they may react violently. The third class of drugs is the ultra-short-acting barbiturates. This includes thiopental, which has a 30 to 60 second onset and will provide 10 to 15 minutes of anesthesia. Also in this class is methotrexate, which has a 15 to 60 second onset and will provide 5 to 10 minutes of anesthesia. These drugs have to be used with pre-medications and also intubation because they will predispose the patient to vomiting. They will increase the salivation and the tracheal secretions. These drugs will depress the cardiovascular and the respiratory systems and also predispose the patient to arrhythmias. If they're injected outside of the vein, they will cause tissue sloughing. They must be titrated to effect after the initially giving a third to half of the dose. If they're injected too quickly, they can cause apnea, and if they're injected too slowly, they'll cause central nervous system excitement. Propofol is a very good drug to use with high-risk patients. It is cloudy, and it's an exception to the rule about not injecting cloudy substances into the vein. It will depress the cardiovascular and respiratory systems, but it provides good muscle relaxation. They will twitch sometimes during induction, and in people it has been reported that IV injection of propofol is painful. It should be given over 1 to 2 minutes until the proper depth of anesthesia is reached. If it's given too slowly, it will cause excitement. The anesthesia will last 2 to 5 minutes, and they will be completely recovered within 20 to 30 minutes. Because of the ingredients in propofol, it should be handled very carefully, aseptically. It should be refrigerated at all times, and any open vials should be discarded after 24 hours.